Hello, welcome to the show. Let's talk health with Dr. Yash Gulati. COVID is raging on, and with added problem of bad pollution, bad air and winter, things may get worse. To discuss this, we have with us Dr. Nikhil Modi. Dr. Modi is a specialist in respiratory medicine. Dr. Modi, you'll agree that COVID is still raging on in the world, in our country, and with the added problems of bad air, pollution, and winter setting in, where do you think we are heading?
Definitely, you are absolutely right that the battle against COVID is still ongoing, and with added winters and the air pollution, we are seeing a rise in number of cases. In fact, we can say the severity of cases has also increased, and also I think people have become complacent. They are not practicing the social distancing, the mask routine which they used to follow initially. They have become lax, and this is adding to the problem.
Very quickly, Dr. Modi, can you tell us how to wear the mask properly?
Yeah, there are two types of masks we recommend. One is the N95 mask or a 3-ply surgical mask. Both are equally effective if they are properly worn. See, in an N95 mask, there is a string. You have to hold the mask, string goes up, and the mask is fitted on the face. Only thing you have to remember is, once the mask is there, the outer surface is the filter, and where the virus is filtered. So please never touch the outer surface, because your hands will catch the virus, and with this unclean hands, if you touch your face, the virus goes into the body. The importance of mask is totally lost.
That's very important. Also, I've seen people, they keep pulling their mask down, and many a time you see their nose is exposed and the mouth is half covered. So, I mean, is that acceptable at all?
That is not acceptable at all. Your nose, mouth, you consider them as new private parts. They should always be covered as soon as you step out. If your mask is down and nose is exposed, this is not at all useful.
That's a nice way to say these are new private parts and we need to protect them.
Definitely.
Dr. Modi, how is it that pollution makes COVID worse? How do we explain that?
See, in any case, pollution increases the risk of congestion in our airways. When it goes inside, the normal ciliary mechanism which clears out secretion is disturbed. There is damage to the lung lining, which exposes this to virus, in fact any other infection causing agents. So similarly, if the COVID virus goes inside, it can easily go into the lungs and cause severe pneumonia and can cause severe disease.
So it's very important to take care of. How do we protect ourselves from bad weather and bad pollution in the air? What do we do?
For the time being, anybody who has respiratory issues, previously they should not be going out in this pollution. And mask is a protective thing not only for the COVID as well as for the pollution. So if your mask is up, you will be protected against both COVID as well as the pollution. So please, whenever you are going out, mask should always be up.
As they say, wearing is caring.
Yes.
So we must wear to protect ourselves and to protect others.
Definitely.
Dr. Modi, there must be many patients who have seasonal asthma, who have respiratory problems even before COVID or bad weather came. So has COVID made it worse, or does those problems make COVID worse? How do they interrelate?
Yeah, anybody who has a lung problem in past is bound to be having a risk to have a severe form of COVID. In fact, the other way around is also there. Those who have had COVID and were previously having asthma, their asthma is now much more severe. They are requiring much more doses of medicine to control their symptoms. So both ways, COVID is affecting the disease and the disease is affecting the COVID. So the measures for both needs to continue, as well as chance of lung damage in already weakened lungs due to COVID is much more. The permanent fibrosis can be much more, and patient can become oxygen dependent for long also.
So how often does COVID permanently damage the lung, and what is the severity of that damage? Is it same in all people, or is it mild in some and severe in some other people?
Yeah. See, mostly whoever develops a pneumonia, whoever has fall in oxygen, that is having a moderate to severe COVID disease, all will have some amount of damage. Now, who responded to the treatment better, who came in early and got treated themselves in an early stage, they are doing much better. The fibrosis is so little that it is not affecting their normal routine. But a person who used to have any comorbidities previously and developed a severe COVID, the fibrosis is much more. They are remaining oxygen dependent for long. It's been 6 months only, and we have seen large number of cases coming with post-COVID fibrosis. So with the treatment, though the people are getting saved, but we are also seeing more and more post-COVID complications too. So whenever you have COVID, I would recommend please see a doctor early, because the complications can be prevented if the steps are taken at proper time.
Dr. Modi, you just mentioned people who came early did better. So, but there's a lot of advertisement on the radio, and even the doctors also, and I also tell people, well, a lot of patients can be treated at home, they can be quarantined at home. So when you say treat early, so who are the patients who need to come to the hospital early? How do you decide that?
Yeah, anybody above 60 years of age is at a high risk. Anybody who has uncontrolled diabetes, heart disease, a lung disease, even kidney disease, or a cancer patient who is on chemotherapy, their immune system is not that strong and they are bound to have severe COVID infection. For them, we recommend early hospitalization. Rest definitely can be managed at home, but in them also regular oxygen monitoring, and with steps proper testing to see the inflammatory response, so that the treatment can be modified and they can be called in early if any changes are occurring, is recommended.
Do you mean everybody above the age of 60 who has COVID should be in the hospital?
See, even the guidelines, the government guidelines say that above 60 they should be at least in a quarantine center. Even we have seen that most of the people who are having complications are above those who are above 60, but many of them have done well also. So at least you, even if you are at a home quarantine, you should be in contact with a doctor who is monitoring you day in, day out, so that anytime any complication he observes, any change in your symptoms, so that the initial intervention can be planned and you can be brought to the hospital. So
and maybe they keep the pulse oximeter
exactly.
at home and the thermometer,
yeah,
they keep
that is
monitoring.
A must even for a young
even for young, everybody should have a pulse.
Yes.
And that's easily available now.
That's easily available now.
And not very expensive also.
In Delhi, I have seen even the government is providing that at home.
Okay, and it's not expensive also.
It's not expensive. You can buy it from a range of 1,000 to 2,000 rupees, and for your life, that's a small investment.
Yeah, that's a very small investment. Dr. Modi, you just mentioned that COVID can cause damage to the lung, but can some exercise, physiotherapy, etc. help to decrease the damage and to save your lung? And so what do you recommend should be the protocol for most people who are not even affected with COVID, or those who had mild disease and those who had rather not mild but severe disease? What should be the protocol later on for them?
Even if you haven't had COVID, I would recommend start having good amount of green leafy vegetables and fruits in your diet, because all the antioxidants, all the vitamins help in developing immunity, so that the burden, severity of disease can be restricted to minimum whenever you have. A daily, regular half an hour of exercise, maybe even just brisk walking or some deep breathing exercises and yoga can help in building up your immunity, keeping your lungs healthy. And even an 8 hours of sleep is recommended, which is a must to develop your immunity, because body needs rest too. So these are the measures which we recommend even if you haven't had COVID. The persons who develop mild symptoms also can practice the same. In severe diseases, sometimes this routine is difficult to follow initially when the patient is on oxygen, but deep breathing exercises and even intensive spirometry has been helping a lot, and patients have shown good results. Even now, post-COVID rehabilitation clinics have been established, in which nutritionists, a psychologist who also takes care of your mental health, which is a must, and a proper respiratory therapist and a physiotherapist can guide you in coming out of these post-COVID complications.
Thank you, Dr. Modi. As they say, prevention is better than cure, and stitch in time saves 9. Dr. Modi just said that be careful of the pollution, don't go out too much, wear a mask, protect yourself, wearing is caring. If something happens, please contact your doctor, do physio, do yoga, do chest exercises, and keep yourself safe. Thank you very much for watching.